Hi again. This is just a continuation of our topic for this week on the health history. Okay. So another component of your comprehensive adult health history is the review of system. Understanding and using review of system questions are often challenging, especially for the beginning students like you. So you have to think about asking series of questions, going from head to toe. So it is helpful to prepare your patient at the start of your uh, health history taking. You can tell your patient that the next part of our history taking may feel like 100 of questions, okay, but they are important and it should be thorough. So you have to explain to the client that uh, the next step is very important. In doing review of system, you must address each body system from head to toe. Usually, most of the questions pertain to symptoms or subjective data that are usually described or verbalized by your client. Some questions may uncover problems that the patient overlooked. So do not use medical terms, for example, blurred vision, diplopia, because it may lead to confusion, no? Because some of the terms or the medical terms may not be understood by your patient. Okay, and then these are the components of your review of system. You have to start from the general, then the skin, no, general or general appearance, the skin, the head, the ears, the eyes, nose, and throat, neck, breast, respiratory system, cardiovascular system, gastrointestinal system, peripheral, vascular, urinary, reproductive system, musculoskeletal system, psychiatric, neurologic, hematologic, and endocrine system. So, isa-isahin natin lahat ng part of the system. Okay. So, in doing review of system, sabi nga natin, we can get the signs and the symptoms. Okay. So, you have to differentiate between signs and symptoms. Signs are usually objective data that you can obtain through physical examination. Example of your objective data, temperature of your client. Okay, sabihin natin 38 degrees Celsius. Nakuha mo yan during physical examination. Or meron kang nakapang mask or bukol. Ayan. And then, symptoms. Okay, what is the difference between sign and symptoms? Symptoms are usually subjective data. They are usually verbalized or described by your client. Like, sasabihin niya, masakit ang ulo ko. Masakit ang ulo ko. Those are subjective data. Okay? That you will usually obtain from history, okay, upon interview. So, habang ini-interview mo siya, ito yung dinidescribe ni patient, sinasabi niya sa iyo, those are the symptoms. Signs, ito yung nakuha mo na talaga during your physical examination. Okay? So, you have to start from general, no? The general appearance. For example, during sa general appearance, merong fever si client or may feeling of fatigue si client. Ayan. And then the skin. Okay, so skin, may rashes, may lumps, may sores, itching, dryness, and changing in the color of the skin. Those are example of your data. Okay, and then we'll proceed to the head, eyes, ears, nose, and throat. For the head, you have to check the size of the skull, the scalp of your client, meron bang lesions, yung hair ni client, evenly distributed ba yung hair, okay, yung eyes ni client, meron bang blurring of vision, nakakapagbasa ba si client ng near, you have to check the near vision, the far vision, using the Snellen chart. The ears, you have to check kung nakakarinig ba si patient, both ears, no? You can use whisper to check the you can use the um, whisper test, watch tick test, and so on. And then for the nose, you can check if there is deviation of the nose, if there is discharge, and so on and so forth. For the throat, is there difficulty of breathing, etc. And then sa neck, you have to check if there is swollen glands, lumps, okay, pain, there is pain, stiffness, or neck na complain ba si patient na sumasakit, may stiffness siya, masakit ang kanyang leeg. Okay? And then sa breast, you have to check if there is lumps, there is pain, nipple discharge, you have to check that also. For respiratory naman, you check kung may presence of cough ba sa patient, ilang araw na or weeks na ba. Sputum, is it, what's the color of the sputum? Is it white, greenish? Hemoptysis, or meron bang blood sa sputum? Dyspnea, difficulty of breathing, may wheezing ba? For the cardiovascular system, you may ask the client kung meron bang high blood pressure or low blood pressure or naka-experience ba ng chest pain or palpitations. Dyspnea on exertion or shortness of breath kapag may ginagawa, or topnia, paroxysmal, or meron ba siyang difficulty or shortness of breathing lalo na kapag naka-lie down. Nocturnal dyspnea, or meron bang shortness of breath lalo na kapag natutulog si patient, or is there a presence of edema sa kanyang kamay, sa paa? Edema or swelling, no, pamamaga. Okay? And then, for the gastrointestinal tract or GIT, you have to ask if the patient experienced stomach pain. So, saan? Yung location, old cart again. Is there swallowing problem? Appetite? Magana bang kumain? Or is the patient experiencing decreased appetite? Nakakaramdam ba ng nausea, vomiting? Bowel movement, meron ba? Yung bowel movement ng client, normal ba? Every day ba? Every other day? Or once a week? Okay, may rectal bleeding ba? Okay, kapag dumumi, may blood ba? Constipated ba si client? Okay, those are the questions that you might ask your client about gastrointestinal system. Moving on to peripheral vascular system, you may ask the client if the patient experienced muscle pain when walking. May leg cramps po bang nararamdaman? May varicose vein? Is there swelling of the legs and the feet? Is there color changes in the fingertips? No? Kapag tinitingnan natin cyanotic, so pwede rin natin i-check yan by pressing, no, the capillary refill, no? Kung bumabalik ba kaagad yung kanyang capillary refill within 2 seconds, no? Nagiging, ipipress down mo yan, magwa-white yan, tapos makikita mo, bumabalik agad yung color ng nail bed. Okay. Pink color. And review of the system on urinary naman. Is the patient experiencing dysuria or difficulty in urination? Polyuria, ihi ng ihi, nocturia, nag-ihi kapag tulog, urgency. Okay, laging nakakaramdam ng ihi na kaagad, burning, may pain, may hematuria, may blood sa kanyang urine, flank pain, suprapubical pain, incontinence, hindi napipigilan yung kanyang pag-ihi, naiihi na sa panty. Then, on the female reproductive system, you may ask your client the age of menarche or the first day of menstruation. Regularity, 1 buwan ba? Regular ba siya? Or delayed? Frequency, gaano ka katagal? Gaano ka monthly ba siya? Every 28 days? Yan. Ang duration nito, is it 5 days, 3 days? Naka-experience ba ng pain or dysmenorrhea kapag may menstruation? For the male reproductive system, you can ask the patient kung meron bang abnormal discharge sa kanyang organ. May lumps ba? May nakakapa? Or may pain or swelling? For musculoskeletal system, you may ask questions related to muscle pain. Is the patient experiencing a muscle pain or joint pain? May stiffness ba? May backache? Masakit po ba yung inyong likod? Swelling, tenderness, may stiffness or weakness, or may limitation of movement ba sa mga extremities or joints? And then, for neurologic, you may ask the client if the patient is experiencing headache. At kapag sinabi niyang may headache, you may ask again yung old card natin. Onset, location, dizziness. May fatigue ba? May paralysis or numbness? Is the patient experiencing a tingling or loss of sensation? Or is there changes in mood, attention, or speech? Naging slurred speech na siya? Is there changes in orientation? So, hindi niya na alam kung ano na bang date ngayon. Nasaan ba ako? Memory, insight, or judgment. So, yun yung way ng ating pag-check. So, pwede mong tanongin si patient, anong date na po tayo ngayon? Okay? Nasaan po kayo ngayon? Ano po yung kinain nyo last 2 days ago? Or kailan ba ang birthday nyo? Anong hinanda nyo ng birthday nyo? Those are just example questions. Okay? For hematologic, may anemia ba? Or is there bruising? Merong pamamasa? So, usually, describe ni client lang yan kasi tinatanong natin siya kung na-experience niya yan. Okay? Endocrine system. Okay, may heat or cold intolerance ba? Kaya ba yung mainit or hindi ko kaya talaga yung mainit, sumasakit ang ulo ko, or sobrang lamig, hindi ko kaya. Excessive sweating. Meron bang thirst, excessive thirst, hunger, polyuria, nag-ihi. Could be a sign na may problem din si patient sa endocrine system. Okay. So, for the health pattern naman, as another component of your comprehensive adult health history, you have to check the self-perception or the self-concept of your client. Ano ba, is it positive ba yung client natin or napaka-negative ng inyong client? Ano yung value niya, yung mga belief niya? Okay, what are the activity and exercises? Sedentary lifestyle ba? Nag-exercise pa si patient? Nag-attend ba ng yoga classes or Zumba classes? Yung sleep and rest ni client, ilang oras siyang matulog? Anong oras siyang matutulog? Tapos, well-rested ba siya pag nagising siya? Nutrition, what are the yung common na kinakain nila? Diba? Pwede mong tanongin si patient. Pwede kang magkaroon dyan ng diet history. Okay? Yung food recall. Okay, i-recall natin ano yung kinain mo kahapon ng umaga, kahapon ng tanghali, kahapon ng gabi, tapos kaninang umaga. So, para makikita natin kung ano yung usual na kinakain ni client. Kung oily food ba, healthy diet ba siya. Role and relationship, okay, kumusta naman ang relationship with the family members, kung married, sa asawa, sa mga anak. Coping stress tolerance, ano yung coping techniques na ginagamit ni patient kapag merong certain problem na na-encounter si client. At hindi natin tanungin ano yung na-experience yung nakaka-stress sa inyo in the previous month. Tapos sabihin niya, ano yung coping na ginawa ninyo? Sabihin niya, nagpunta lang ako sa church, nagsimba ako. Those are examples. Okay? So, guidelines for sensitive topics, no? Lalo na yung mga topics about sexual topics, use of drugs. So, how will you communicate with your client? So, these are the guidelines, no? For sensitive topics. The single most important rule is to be non-judgmental. Huwag ka pong judgmental. Pag sinabi ni client na nagsisigarit ako, ay kaya ka naman pala hinihiga kasi smoker ka. So, hindi natin pwedeng i-judge ka agad yung patient kasi hindi na niya magugustuhan magbigay pa ng information about him. So, just listen, okay, be empathetic, Try to understand. Explain why you need to know the certain information. Bakit kailangan mong itanong yung mga questions na yun? Kasi posibleng pwede mong explain sa kanya. Halimbawa, tinatanong mo siya about sa sexual nakailang sexual partner ka po. Diba? So, medyo sensitive ang issue na yun. Baka akala niya nakikipag-chismis ka lang. Kasi po, itong information na makukuha natin is related to the symptoms na nire-report po natin para mas ma-check po natin kung ano po yung possible cause ng inyong current problem. Find opening questions for sensitive topics and learn the specific kinds of information needed for your assessment. Ano ba yung kailangan mo? Hindi mo naman siguro kailangang tanungin kung ilan ang kanyang naging sexual partner in the previous months. Kung hindi naman rin, kung abdominal pain lang yung sinasabi niya at walang ibang nakikitang signs and symptoms. Pero kung kapag meron na yung may vaginal discharge, abnormal discharge, ayan, pwede mo itanong yung mga possible questions na yun. Okay? Consciously acknowledge whatever discomfort you are feeling. Denying your discomfort may lead to avoid the topic altogether. So, kapag ikaw mismo hindi ka comfortable sa mga questions mo, pwede natin, yung discomfort na yun, pwede na maaano ninyo yung importanteng topic, mai-skip ninyo because i-avoid nyo na yung topic na yun. So, you have to acknowledge that yung mga topic na yun, kailangan mong itanong to your patient. Okay? Determine risk for pregnancy. Ano ba yung mga risk sa mga pregnancy? No? Risk for sexually transmitted diseases. Kapag halimbawa may multiple sexual partners, tapos hindi gumagamit ng condoms, yan, risk talaga yung patient ng STD. Sexual practices may lead to related patient symptoms. Diba? Sinabi nga natin, kung iba-iba ang partner, pwedeng magkaroon ng HIV si client. Okay? Sexual dysfunction may result from use of medication or misinformation. Be matter-of-fact in questioning and use a specific language. Do not use confusing language or medical term. Make no assumptions about the patient. Huwag kang assuming. Okay? Be aware of cultural constructs. So, na-mention na rin natin yan in our previous discussion kung ano ba yung culture or practices ng iyong patient of how to communicate properly with your client. Be sensitive to reports of mood changes or symptoms of possible depression. Okay, dapat naintindihan natin yan na yung questions mo baka nagtitrigger na pwedeng mag-breakdown si client. Okay? Ask open-ended questions initially. Diba? Sabi na natin, dapat open-ended questions parang cone yan. So, yung lead opening, ito yung open-ended questions. Tapos, focus na tayo kung ano yung problem na identify natin. And then, lastly, the yes or no question tayo. More specific. Ask about using psychotropic medications. Okay. Nagkaroon ba ng depression, ng psychiatric problem? Na-hospital ba? Ano ang mga medications na ibinigay sa kanya? If patient seems depressed, ask about thoughts of suicide. Yan. Nakita mo yung medyo nadidepress si patient. So, paano mo naman itanong? Diba? Tatanungin mo yun. Kung umaabot ba sa kanyang isipan na gawin ang ganitong mga bagay. So, you have to make sure na hindi rin, do not ask question by starting why you want to do this. Diba? Kailangan open-ended question siya na hindi rin siya interrogative ang dating doon sa inyong patient. Ngayon, authorities recommend a routine screening for domestic violence. Start with general questions and move to more specific. Okay? If abuse is suspected, it is important to spend part of encounter alone with the patient. Baka mamaya ayaw ni patient na habang ini-interview mo siya, nandyan yung kanyang relatives, no, or family members. Kasi sometimes yung nag-abuse talaga ng ating patient is one of the family members. So maybe, pwede mong sabihin sa patient, are you comfortable if I conduct the interview with with the presence of your relatives or your brother or your father? Pag sinabi na she or he is not comfortable, you may ask the relative to give you time together, no, para makapag-verbalize or para makapagsalita yung patient about it. Do not force the situation kung hindi pa talagang ready si client. Ask parents how they cope with their crying baby. Ito yung example natin, no, para malaman natin kung paano sila mag-handle, no? Paano sila mag-handle? Pinapalo ba nila si baby? Kinakarga ba nila? So, doon natin malalaman kung paano mag-cope yung isang parents. No? Those are just example of sensitive topics. Be alert to non-verbal communication. No? Yung gesture, yung reaction ni client. So, dapat na-observe din natin. Okay, for physical abuse, you should consider in the following situations. If injuries are unexplained, inconsistent with story, concealed, or cause embarrassment. Okay, so physical abuse, so baka may presence of physical abuse. If patient has delayed getting treatment for trauma, or if a past history of repeated injuries or accidents, so possible mayroon nga talagang physical abuse. If patient or person close to patient has history of alcoholic or drug abuse, yan possible din. If partner tries to dominate in the interview, no, in-interview mo yung wife, tapos talagang ang sumasagot agad yung husband, no, kasi parang kinukover niya na kaagad, baka may masabi pa yung wife niya. Okay? And the relatives, no, or the partner will not leave the room, ayaw niya talagang iwanan, or seems unusually anxious or solicitous. Yan. Okay? So, okay, form of documentation is computerized if you are lucky, no? If you are working in a high-class hospital, no? So, pero kapag nandito lang tayo sa mga public hospitals, usually, charting lang tayo or may mga forms lang tayo na i-fill out. So, make sure that the information must be accurate and thorough, and make sure to write down all answers of your client, because you have to remember that if you did not write it, you did not ask it. Okay? So, what is not written is not done. So, this is the end of our topic for this week. So, let me end by reading this quote by Caroline Jarvis. The character of a nurse is as important as the knowledge she possesses. Okay, God bless everyone, and see you again next week. Thank you very much for your time. Thank you for listening. These are the references of this presentation. God bless everyone.